Hi everyone, welcome back to my channel, and in this video I will teach you about all these first disease, second disease, third disease, fourth disease, fifth disease and sixth disease. What are the name of these diseases? With mnemonics I will teach you, and along with that I will also teach you the causative organism of this disease. The first is the first disease. First disease is measles. So first is me, that means measles. The second is scarlet fever. Second is that is scarlet fever. And third disease, after that the third disease is rub. See, three letters, 1 2 3, rub. So after the scar happened in the second disease, we are going to rub it. So it is third disease, rub, three letters, rub. Next is that is rubella. Next is the Duke's disease. What is the number of letters in Duke? D-U-K-E, Duke. See, D-U-K-E. So fourth disease, that means 4 letters. Duke is the 4 letters. So Duke. After rubella it is Duke disease. So 1 2 3, that is rub, R-U-B, third disease. Duke, D-U-K-E, 4, that means fourth disease. So first let us revise from first again. First disease is me. First is me, that means measles. First is me, that is measles. Second is S for second, S for scarlet. S for second, S for scar, or you can remember scar. So S for second, S for scar, that is second disease, that is scarlet fever. Third, so you can see third disease, that means 3. So it is rub, R-U-B, rub, R-U-B. You rub the scar. So you rub the scar, rub, R-U-B, rub, R-U-B, 3. Next is fourth, Duke, D-U-K-E, Duke, D-U-K-E, 4. That means fourth disease. Next is fifth, that means the fifth disease, erythema infectious. What is erythema infectious? That is slap disease. You know, slap cheek disease, slap cheek. If you slap a child, then it will look like the cheek is slapped. So that is slap cheek disease, that is fifth disease. And with the help of the 5 fingers we slap. So you can remember, with the help of the 5 fingers we slap. So fifth disease, 5 fingers, 5, that means fifth disease is the slap cheek disease. Slap cheek disease, erythema infectiosum. Erythema infectiosum is nothing but slap cheek disease, which is fifth disease. With the help of the 5 fingers we slap. So fifth disease. Next is sixth disease. How can we remember sixth disease? After you slap a child, what will you do? You will give rose to the child. So roseola infectiosum. Roseola infantum. So it is sixth disease. So roseola infectum, you give rose to the child after slapping. So after slapping, that means after the fifth disease, after the 5 finger slap, you give rose. Remember this, after the 5 finger slap, you give rose to the child. So 5 finger slap, that means the fifth disease, that means the erythema infectiosum. And after the 5 finger slap, you give rose to the child, that means sixth disease is the roseola infantum. So first one, let us revise from the first. Okay, first disease is measles. First is me, I. So it is me, measles. First is measles. Second is, after second, S for second, S for scarlet, S for scar. So you can remember, S for second, S for scar or scarlet fever. So second is scarlet fever. Next, third is the rub. So you rub the scar. Remember, rub the scar. So R-U-B, rub means rubella. So it is 1 2 3, R-U-B, 3. So third disease. Next is Duke, D-U-K-E, 4 letters, D-U-K-E, 4 letters, that means fourth disease. Next is the fifth disease. I told you, 5 fingers slap and then you give the rose. Remember, 5 fingers slap and then you give the rose to the child. So 5 finger slap is the fifth disease, that means erythema infectiosum. Next is the sixth disease, that is roseola. After you slap, you give rose to the child in the 6th day. After the fifth disease, you give sixth disease rose. Okay, remember. So let us revise the causative agents also. So first is measles. First is me. So measles is caused by measles virus. Second, scarlet fever is caused by Streptococcus pyogenes. It forms pus. So it is pyogenes. Streptococcus pyogenes. Remember, pyogenes. Next is the rubella. Rubella caused by rubella virus. Rubella caused by rubella, also known as German measles, caused by rubella virus. Rubella virus. So measles virus, rubella virus. The middle one, that is a scarlet fever. The scarlet fever is caused by Streptococcus pyogenes. Streptococcus pyogenes. Next is the Duke. Duke is caused by the Eco virus or Coxsackie virus. Coxsackie or Eco. Either Coxsackie or Eco. Coxsackie or Eco. Probably. People do not know about the Duke. So always remember, probably Coxsackie or Eco. Coxsackie or Eco. Coxsackie or Eco. Coxsackie or Eco. Next is erythema infection, the fifth disease. Fifth disease is the fifth disease. Remember SLAP. So it is caused by parvovirus B19. Parvovirus B19, very important because it comes in several times in the FMG and NEET PG examination. Parvovirus B19, SLAP disease, slap chick disease, erythema infectious, fifth disease, five finger slap, you remember. So it is caused by parvovirus B19. Okay, parvovirus B19. Next is the last one, that is roseola infectiosum. So after you slap the child, you give the rose. So after you slap the child, fifth finger disease, you give the rose on the sixth day. So sixth disease. It is caused by herpes virus. Herpes, mainly the 6, mainly HHV 6, herpes 6, mainly herpes 6 and 7 also sometimes. So remember 6 and 7, herpes 6 and herpes 7. So once again, let us revise all these things. First disease, first will be me, first is me, so measles, caused by measles virus. Second is S for scarlet fever, caused by the streptococcus pyogenes, pus forming pyogenes. Next is the third disease. Third is after you get the scar, what will you do with the scar? You rub the scar. So RUB, rub means rubella, caused by rubella virus. Third disease. Next is Duke, 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 the fourth disease. DUKE, Duke, fourth disease. So what caused the Duke's disease? Duke disease is caused by Coxsackie or Eco virus. So always remember Coxsackie or Eco. Probably we don't know. So Coxsackie or Eco. Next is erythema infectious, the fifth disease, the fifth slap. You remember the fifth disease, you slap the child and then you give the rose. Remember the mnemonic? You slap the child, give the child a rose. So fifth and sixth disease. Erythema infectiosum, which is the fifth disease, caused by parvovirus B19. So slap chick disease. Remember this. Slap chick disease caused by parvovirus B19. And sixth disease. The sixth day, what will you do? You give the child a rose. So roseola infantum. It is caused by herpes virus. Remember, it is caused by, the last one is caused by herpes virus. Herpes 6 and 7, mainly 6 and 7. You can remember 6 and 7. Herpes 6 and 7 cause roseola infantum. So this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel. You will get a lot of information and lot of mnemonics and medical videos from this channel. Thank you so much. It will help you to crack your NEET PG and FMG examination. If you are a FMG aspirant, if you are a NEET PG aspirant, please subscribe this channel. Thank you. Have a nice day. Bye bye.